From Eyewitness News, Connecticut's most watched local political program, this is Face the State.
Good morning, everyone. I'm Dennis House. Thanks for joining us for Face the State. And today our program is focusing solely on coronavirus, COVID-19. It's the biggest health threat to hit Connecticut in a century, and it has brought our state to a virtual standstill. With us now is the Chief Operating Officer of our state and one of Governor Lamont's closest advisors, Josh Geballe. And Commissioner Geballe, good to see you here on the program here today.
Good to see you too, Dennis.
And I want to ask you, first of all, what has led to this week? Because I know that you were having backdoor discussions with the governor for many days. What finally led to the big announcements this week?
Sure. Well, we've been preparing for this since the middle of January as we've seen what was developing in China and overseas and starting to come to the U.S. But the governor was very clear from those early days that knowing that this could become a pandemic, that taking decisive action early before it really starts to spread can have a really meaningful impact in spreading out those infections and helping our healthcare system cope with them. And so when we saw the first case come in Connecticut, Danbury Hospital worker last Friday night, the governor got everybody on the phone afterwards. We talked about what we're going to do. We got the legislative leadership together on a bipartisan basis to take some very bold actions that I think now as we end the week have positioned us well and I think very aggressively to ride this out.
You were there when Dr. Carter, Matthew Carter, the state epidemiologist, made quite a dire warning. He said people will die from this, some will not survive. 20% of the people could get it. Are those numbers conservative?
Well, we don't know, right? This is a new virus. People public health professionals are modeling this. They're looking at 1918, as you mentioned in your open. They're looking at the other more recent pandemics that have occurred. But at this point, these are models. These are estimates. So what the important thing is that we're doing everything we can today to prepare ourselves for what could come. The governor has been listening very carefully to the public health experts, and that's been really informing a lot of these early decisions.
What are the doctors and medical experts telling you might happen here in our state?
Well, we're expecting, a rough couple of months, Dennis, right? I mean, we're now, we're taping this on Friday. I think by the end of the day today, most of the schools in the state will probably be closed. We've canceled large events, sporting events, concerts. Businesses are making adjustments. I mean, this is going to be a very disruptive time for people. But we're going to get through it. We've gotten through all the ones before, and people are pulling together and stepping forward in very important ways.
Some of the schools are closing for just 2 weeks. They're planning on reassessing as they reach the end of that 2-week period. Do you believe that they'll be opening on that third week?
We'll see. At this point, I think it's unlikely, but it's a very fluid situation, and we'll see where we are as we get there.
There are some on the other side saying that school's going to be closed for the rest of the year. Do you believe that?
It's possible. I think we've seen a lot of the higher education institutions in this state basically say that send their students home and bring your stuff as if you're not coming back, or prepare for distance learning for the rest of the year. So I think people are taking the right precautions now to plan for those possibilities.
Yeah, there are still some private businesses open, malls and things like that. Is that a good idea, do you think?
Yeah, one of the reasons you take a lot of these other actions is to not have to put yourself in a position like China or like Italy where you really have to lock everyone down, right? We want it, and the governor's been clear, this country's different, right? We have we want to protect those personal freedoms and give people the opportunity to go out to the grocery store, to go out for a meal. So we're not there, at least not yet, but we're hopeful that by taking a lot of these other actions very early in the spread, that we can preserve the ability to do those things further down the road.
I was at a supermarket in West Hartford last night. It was a madhouse. There were people stocking up on all sorts of things, toilet paper completely gone. What's your advice to people? Because they're stocking up on things that people are saying, why do we really need extra of that?
Yeah, I think people should stay calm, right? And I think that there are some people who, people are concerned, and understandably so. But the way to deal with that concern is to do the common sense things that the public health professionals are recommending. We've taken a lot of those actions with regards to social distancing, and so think through the different parts of your life and the social distancing you can do to slow the spread. But yeah, people need to keep their calm.
What is your advice to families besides keeping calm next week if they're home with their kids for the next couple of weeks? What should they be doing with them? Because attractions are closed. Should they go to stores? Should they go to restaurants, or should they avoid those things?
Yeah, it's funny. I have 2 kids, and my wife and I were talking about this the other day. It's gonna be a challenge for people. to be kind of closed in with a lot of stuff closed. Look, I think the recommendations from the public health professionals are, to the extent possible, don't go out and mix around with lots of other people. That said, if you need to go to the grocery store, if you need to go to the pharmacy, if you want to go out for dinner, do it. Just make sure first, before you go out, nobody's not feeling well. If you're not feeling well, you need to stay home and self-isolate. But if you're feeling fine, then life continues.
What do you tell the people like nurses who have to go to work, perhaps a single mom who depends on daycare for her children, or depends on school, and now she doesn't have that option?
Yeah, so this is a major focus, both at the state level, the federal level, the state level, and the municipal level, is making sure we have the supports in place in the short term, particularly for our healthcare workers, for our first responders, the people who need to be able to go to work every day to help battle this virus. So we're looking at things like additional support for childcare. We're also looking at the fact that this is going to be incredibly disruptive to our economy, and small businesses are hurting. A lot of people who work hourly jobs, or some people may lose their jobs. And we are working on a package with the legislature, looking at federal funds about how we support those people through this time.
Do you expect that we will lose businesses over the next 2, 3, 6 weeks, depending on how long these shutdowns last? I mean, there are mom and pop stores that have to pay mortgages and rents and bills and things like that.
Yeah, we're going to be working very hard to prevent that from happening. We're going to be rolling out some economic supports in the coming days here to try to help businesses bridge this time. I mean, this time is going to pass, the experts say, but we just got to help them get through that.
Let's talk about our hospital structure in our state. Do you believe we are handled, that we are structurally sufficient where we can handle 20% of the population getting coronavirus?
Yeah, I mean, I think we are blessed in this state with an incredibly strong healthcare system. Our hospital networks are incredibly well prepared. I was talking with an expert at one of our hospitals the other day about the contingency plans they're making of moving patients around floors, creating extra space. Really, really impressive stuff. Now, that said, we need to help them. All of these social distancing measures, the school closures, the big events, this is all designed to help those healthcare professionals by, rather than seeing an exponential surge in those acute cases that all flood in at once, smoothing that out so that they can take care of patients on a more steady basis and not get overwhelmed.
Let's talk a little bit about all the students who are in school, and a lot of seniors who, if schools close the rest of the season, what happens to them in terms of graduation and getting their diplomas?
I know. There's some really difficult, heartbreaking things that people are thinking about right now. And some of those issues we just don't know yet. We're going to be looking at that in the coming days and weeks. But this is touching every corner of the world, every type of activity.
Would the state waive requirements so they could just at least get the diploma, even though there's no ceremony necessarily?
Yeah, I mean, as I think this week we waived the 180-day rule, so we've given schools the flexibility to end on June 30th, no matter how much time is missed. But in terms of graduation requirements, we haven't gotten there yet.
And what about state government? This is the legislative session. That's all on hold right now in terms of passing bills and necessary things that need to be done. Will that be extended?
Although our legislative leaders I know that they are working on options about how to keep business moving virtually. Very complicated, challenging questions, but a lot of people are looking at this, and I think we'll learn more next week.
Josh Geballe, the COO. You're still a commissioner, which is why I called you commissioner. You're commissioner of DAS. Double roles right now. Thanks for being on the program. We appreciate it. In a moment, how hospitals are coping, and a doctor explains what you need to know about coronavirus. Later, the flu pandemic of 1918. And you can watch past editions of Face the State right now on our app and our YouTube channel.